Okay, Ruth, we are live on YouTube.
Welcome, everybody, to our committee meeting for older adults, health and welfare and housing. And tonight we have guests from Maimonides Hospital to speak to us about the latest that's going on with health and hospitals. So I want to introduce Amir Abadi. We remember him from a few meetings ago, and you told us all about the amazing services that Maimonides has, and we welcome you along with Mr. Douglas Jablon. Thank you so much for coming.
Thank you.
Thank you so much, Ruth, and thank you, board, for allowing us a chance to speak tonight. I'm joined by Sherry and Sam and the great Douglas Jablon from our Maimonides team. I'm going to go through a brief PowerPoint to update the board on the ongoing conversations we're having with health and hospitals and the impact it's going to have on our ability to continue to provide high quality care to the people of this community. Let me share my screen. Okay. Can everybody see?
Yes.
Beautiful. Okay, so just reintroducing Maimonides for those who don't remember. We are three hospitals that serve through 80 different locations across the borough of Brooklyn with high quality facilities at all of our locations, providing care for 320,000 unique patients, including another 800,000 outpatients at these facilities. We have the state-of-the-art pediatric center that I presented on a few months ago, breast center, several other facilities across the 80 locations that I mentioned. Now, the thing that I want everyone to understand is our designation as what's called a safety net hospital. Now, safety net hospitals are hospitals that disproportionately serve Medicare and Medicaid patients. Now, Maimonides is the largest Medicaid provider in the borough of Brooklyn. So we're an anchor institution as a safety net provider of healthcare for the people of Brooklyn. With the finances of this responsibility on our shoulders, I want us all to understand that nationally, hospitals receive 70 cents on the dollar for every Medicaid patient they receive, and 82 cents on the dollar for any Medicare patient they receive compared to private insurance. So there's already an institutional gap between what a person with Medicare and a person with Medicaid is receiving as a billable patient to the hospital versus a person who receives private insurance. Now we're going to go into a little deeper what that means for our organization financially in a later slide. But the state of New York has done a wonderful job of supporting our institution and institutions across the state to address this financial difficulty. And safety net providers like ourselves have constantly turned to the state for its leadership and its stabilizing influence going forward. Now, the trajectory of this issue has been going in the wrong direction for some time. This is an issue across the state that the state has tackled year after year, where the cost of providing care and the difference between what Medicaid and Medicare pays versus what private insurance pays has been getting more severe and more severe. Meanwhile, our hospital has continued to be that anchor institution providing the highest quality care possible to more and more Medicaid patients across the borough of Brooklyn. And this creates a financial situation where we are receiving less billables per patient while also dealing with more at risk of need patients. And that's where we get into the conversation that we're in now on how our organization can continue to provide a stable financial outlook going forward. Now, with labor costs outpacing revenue, the state has been flat in its payments for Medicare and Medicaid in the recent past. We are now part of the 75 safety net hospitals since the pandemic that have been receiving emergency funding from the state. But with things like federal budget cuts, our outlooks are challenging in the near future. Now, even with all these challenges, we are still incredibly proud of the service we're providing the people of Brooklyn. From 2023, when we opened our Bay Ridge Emergency Department, to the 2024 opening of our expanded NICU, to 2025 when we celebrated the Brooklyn's only standalone children's emergency department. We continue to be number one as a children's hospital. We have the top 1% survival rate every year since 2018. We are an anchor institution that is incredibly proud of the services we give. But in order to maintain those services, to expand those services, and to keep building on those services in the future, we need to create a plan that addresses this fiscal reality. Since 2014, our board has been directed to look for partnerships that would allow us to address the physical challenges I mentioned, maintain and expand our services, continue to serve the community that we love, and strengthen our financial outlook. And that decade-long search has reached its apex with a new funding stream the state has made available to us. We are glad to be in partnership with New York City Health and Hospitals. And with that partnership, we were able to access a $2.2 billion 5-year state safety net transformation grant. That grant will allow us to transform our institution and provide a long-term financial outlook that will allow us to do things like provide a state-of-the-art electronic medical record system, which will make it easier for patients to access their care. It'll also allow our financial outlook to be a lot more structured, which will allow us to continue to do the capital and operational projects that will continue to provide the highest quality care and the cutting edge services we provide today. So this $2.2 billion grant is broken over 5 years, and it will support both the operation and the renovation of our hospital, and it is provided in partnership with our ongoing relationship with New York City Health and Hospitals. Now, we're joining the partnership with New York City Health and Hospitals because of this unique opportunity it presents. We'll be receiving about $100 million in added revenue simply because public hospitals receive a better rate of reimbursement than an organization like ours. That allows our financial outlook by being a partner with health and hospitals to improve our outlook regardless of the funds we're receiving from the state. We'll also be providing their existing hospitals with expanded access to the specialty care our hospital provides. The world-class care I mentioned earlier is something that public hospitals across Brooklyn are desperately looking to tap into for their patients. We would also be able to improve the coordination of our care across our Brooklyn network, thanks to the investment this grant will create in our infrastructure. For those who ever used MyChart, for those systems those systems are systems we would love to integrate into ours to simplify the access a patient has to their records and simplify communications within the hospital network as a whole. So as a part of this systemic conversation we're having with health and hospitals, we wanted to come to the board to discuss the progress we're making in those conversations and the optimistic outlook it's created for our long-term future because of the new opportunities it's creating. Now, a partnership allows us to expand our specialty care. It will also allow us to utilize high-performing services, as I've mentioned, and really invest in that equipment, those facilities, and our staff capacity because of the financial outlook because of the improvements in our financial outlook. We are currently in conversations hoping to finalize that partnership with health and hospitals and with the state regulators with the goal of a final agreement by April 1st of this year. Now, this is a optimistic timeline, but we have great faith that it will be able to integrate well with the state budget cycle. We are in pretty rapid discussion with these agencies and with the city's new mayor's administration. And in order for us to make sure that the community has as much information as possible as these conversations unfold, we wanted to make it a point to come before the community board and give them whatever update we had as those conversations continue for the next few months. The plan is to transition without it impacting patient care. Conversations on how to make that transition as smooth as possible are currently ongoing. Some of the people on this call are meeting regularly with Health and Hospitals leadership in order to make sure the identity of Maimonides is honored and supported as this transition occurs. One of the biggest things we're trying to implement as quickly as possible is Epic. Epic is that digital integration, the electronic medical record system that will allow us to really leap into the 21st century and create a level of synergy across our system that we have been longing for some time. And we want to continue to communicate with our community partners like the community board as we start to develop more details about how this process is going to unfold. Right now, we have a framework for what integration looks like, but a lot of the details are still being worked out in our ongoing negotiations with health and hospitals and with the state so that we can be a part of the health and hospitals family. Any questions?
Is this a merger or just an opt-in for a program?
Yeah. So the legal definition of this is an asset transfer. And we use the term partnership because it's very legalese and partnership summarizes it in a much better way. We would be a part of the health and hospitals family. We would have some employees that maintain independence. Other employees would transition to health and hospitals, but there's a lot of details being worked out about the specifics of how
So
that looks.
basically, you'd be transferring 100% of the shares of Maimonides into health and hospitals. They'd be basically merging with you.
The
Basically,
building
I would say
itself.
for all intents and purposes, it's not 100% of the assets. There are some things that will remain in a different entity, in a sort of legacy Maimonides entity for legal
Understood.
and regulatory issues. But yes, essentially, we would be becoming a New York City Health and Hospitals.
Would it stay Maimonides named?
Yes.
Okay. Thank you. Thanks, guys. Very thorough.
Sandra? Senya?
Yes. Hi, Douglas. It's Senya from the NIA office. How are you?
How are you? Long time no speak.
Yes. Quick question. I'm not sure if this is too soon to tell or not. But with this situation going on, since I handled the social services aspect, do we know like that you guys will still be accepting the same HMOs? For like example, New York Presbyterian no longer takes health first. Do we know if that is the realm you guys may be taking, or is it too soon to tell?
We will accept all the same insurance that we accept now. But I think I can say that with no problem, because Health and Hospitals accepts everything. And so,
Okay. Thank you.
yes, that will not be an issue.
Thank you.
Dr. Ramawi?
Yeah.
Oh, Dr. Ramawi.
Hi, I'm Mr. Joglan. How are you?
I love you. I love you.
How are you feeling now? How's your surgery? You look very good.
Your prayers helps me.
Yeah, we will be seeing you next week.
Thank you. I love you.
We love you too. Yeah. So how do you look at these new things in Maimonides? Are you looking forward for it, or you feel that you are being like left behind, or what is exactly your feeling about it?
I'm sorry, I got cut out for a minute. What was the question? Dr. Ramawi, what was the question again? I'm sorry.
I guess
My
how you
question is that how
What?
you feel about
the merger?
new regulation for Maimonides. Are you looking forward for it, or you think that they are putting the hospital back, or what do you think exactly about it?
I think Douglas froze. I think his screen. Did everyone freeze?
I feel that
Technical.
Yeah.
Sorry, it seems like we've temporarily lost Douglas.
I don't know if anyone else wanted to tackle that, just general feelings about the merger and.
I'd be happy to answer that. I think this merger presents a wonderful opportunity for our organization because we've had some complex financial outlooks for the
what's going
last
on.
few years.
It's going to be a stronger hospital. When I talk to Dr. Ramawi, I always freeze. I'm sorry. I'm right here.
He's back. Okay.
Douglas, you want to just repeat yourself? I think we lost you for a second.
He said, repeat the question.
I'm sorry. My phone is so bad. Do you see me now? No, I don't see you.
We can
We
hear
can
you
hear
now.
you.
Yes.
Okay. Do you see me now?
Yeah, I always look forwards. I look very high to you guys, the people who are governing and controlling Maimonides Hospital. We always look forward for you to get better and get more improvement. So I just want to know, how do you feel about these changes which are happening to the Maimonides Hospital? Are you looking high up to it, or you are not optimistic about it?
I believe that we're going to be much stronger. We have a lot of backing now. We're going to have much more better equipment. And I feel that it's only, Dr. Amawi, believe me, I feel that we're just going to become a stronger hospital to serve the communities that we serve. And that's how I feel.
Okay.
Is this like a similar situation like when Langone took Lutheran? Lutheran became Langone, they didn't keep their name, but is it pretty much like the larger hospitals seem to be taking
Pac-Man,
over?
hospital Pac-Man.
Yeah, I mean, there's been a lot of consolidation in the market over the last few years, and you know, there's not that many of us sort of solo hospitals still standing. So
Yeah.
Yes, you know, similar, we are becoming part of a bigger system just because the finances don't really make it possible to not be part of a bigger system anymore.
Great, thank you. Danielle Mallory, Danielle, you have your hand raised?
Yeah, I was just wondering, how does this impact the unions?
The union contracts are, the intent is that the union contracts remain intact. They don't change at all. And so we're working closely with H&H and our union partners on this.
And how will it affect, though, like in terms of employment and things like that? Will they be put into a different pecking order, or will things stay contained within Maimonides in terms of scheduling and seniority and stuff?
Yes, that will all stay the same.
Okay. Thanks.
Sure.
Will they be hiring more people, or will they be taking people from health and hospitals over? Will people be losing their jobs who are currently at Maimonides? I mean, doctors. I'm talking about other staff, nurses, etc.
Yeah, there's no intention to do cuts. I mean, I think we're entering a challenging time period for healthcare overall with all the federal cuts coming down. So it's hard to say what will happen in the future. I think just broadly for the whole industry, but it's not Health and Hospitals' intention to come in and make lots of cuts or make big changes. They really want to keep Maimonides.
Well, it's certainly been there for a really long time. And I, for one, am very happy to hear that things should look from the outside, at least, like everything's moving on, and that you guys are going to continue with the expansions and growth for new programs that you have been doing up until now. The presentation that Amir made to us a while ago was really, really impressive, describing the emergency room services and the pediatric services and so many other things. So I think that we're all relieved to hear that Maimonides is expected to continue as a quality hospital for patients and the community.
Thank you. And we'll look forward to continuing the partnership with the community board.
You can ask Dr. Ramawi. We delivered a beautiful baby grandchild for him. Right, Dr. Ramawi?
Yes, that's right.
Congratulations. That's the kind of news we like.
We always look forward to see you, Mr. Joplin.
I love you, Dr. Ramawi.
You're a really good friend to us.
I tell you, I was so sick. I got to tell you a fair story. I know it's off. I was very sick about 10 years ago. I couldn't get off the bed. I just couldn't move. And the doctor said, I got to get Douglas off the bed. And guess who my wife called? Dr. Ramawi. I walked around the floor 10 times. Remember, doctor?
Yes.
You don't fool around with Dr. Ramawi, that's for sure.
Oh, that's great.
This is good to know.
Good to know.
He's a friend of the whole family. My wife likes him. My kids like him. He's a real good friend. Really.
I love you.
This is great. This is good news. We have good news.
His name is because it says Amir Abadi.
Yeah,
Well, we love having Maimonides in our midst very much, and including the emergency room in Bay Ridge. It's really a gift to our community. And we always hear very, very positive things about how attentive staff is, how clean it is, and how efficient they are. So we thank you all for that. And as a matter of fact, my neighbor told me she's taking her son to the ER, the pediatric ER at Maimonides. I said, no, that's not the closest. Why are you going there? They have the reputation for kids. Her husband's a physician elsewhere. She said, that's the place for kids. So we thank you for that. Is there anything that we can do for you as subcommittee of the community board?
Well, we will hope to be back towards the end of this process to give you one final update about how it completely unfolds. So when you get an invitation from me, I would appreciate just another chance to check in with you guys.
Absolutely.
Perfect.
Do we have any other questions for the staff who's here?
No, looks good. No more questions, Ruth. So,
Just give Dr. Amawi a hug for me, that's all.
well,
You have your own cheering section.
very good. All right, Ruth.
Okay, well, I hope next time, sometime soon, we'll be able to be together in the same room. Makes it,
Only for good things and only for maternity.
oh. Yeah, well, not all of us are ready for that
Well,
right
families.
now. And families, for the families, yeah. Lots of maternity.
All right.
Okay, thank you, everybody, for
Only-
coming.
Thank
Thank
you.
you. Have a